Why healthcare is so expensive in America. Freedom is priceless, but in the United States, it often comes with a bill. In America, even getting sick can be a financial decision. For millions of people, one visit to the hospital can mean months or even years of debt. So why is healthcare so expensive in the richest country on earth? Let's break it down and compare the American system to the rest of the world. 1. The price of freedom. In most countries, healthcare is something people barely think about. You get sick, you go to the doctor, you pay little or nothing. In the US, it's different. Healthcare is built on the idea of personal choice and private competition. Americans can choose their doctors, their hospitals, their insurance plans, and as a result, they also pay the price. The average American spends more than $13,000 per year on healthcare, the highest in the world. That's almost twice what people pay in countries like Canada, France, or Japan. And yet life expectancy in the US is lower than in most developed countries. 2. Insurance, the middleman, that costs billions. In theory, private insurance should make things more efficient, but in practice, it often does the opposite. Every insurance company has its own network, billing codes, rules, and bureaucracy. That means millions of dollars go not to doctors or hospitals, but to paperwork, billing departments, and executives. Administrative costs make up nearly 25% of total healthcare spending in the US. In simpler terms, for every dollar spent on healthcare, about 25 cents go to managing the system, not to actual care. Meanwhile, other countries with universal systems, like the UK's NHS or Canada's single-payer system, have administrative costs closer to 3 to 5%. 3. The power of big pharma. Another major reason is drug prices. In America, pharmaceutical companies are allowed to set their own prices, and they do. There's no government limit on how much a life-saving medication can cost. A simple example, insulin. In the United States, a vial of insulin can cost $100 or more. In Canada, the same vial costs about $10. Why? Because in most countries, the government negotiates directly with drug companies to keep prices fair. In the US, that kind of negotiation is limited, and lobbying by pharmaceutical giants makes sure it stays that way. As a result, Americans pay more for the same medicine than anyone else in the world. 4. Hospitals that act like corporations. Healthcare in America is also expensive because hospitals operate like businesses. Many of them are technically non-profit, but that doesn't mean they don't make money. They just reinvest profits into higher salaries, new buildings, or expensive technology. A single MRI scan in the US can cost $1,200 to $3,000. In France or Germany, the same procedure might cost around $300. Part of the reason is the sticker price system. Hospitals often charge several times more than the actual cost of care, expecting insurance companies to negotiate it down. But when you don't have good insurance, you get stuck with the full price. And that's how a short hospital stay can turn into a $20,000 bill, even with health insurance. 5. Medical debt. The American nightmare. More than 100 million Americans carry some form of medical debt. That's nearly 1 in 3 adults. People go bankrupt not because they bought a new car or a big house, but because they got cancer or had a car accident. Medical debt has become one of the leading causes of personal bankruptcy in the US. In most European countries, that concept doesn't even exist. You can't go bankrupt because of medical bills in France, Germany, or Sweden. For Americans, it's part of life, and part of the cost of living in a system built on individual responsibility rather than collective care. 6. The argument for freedom supporters of the US healthcare model often say, yes, it's expensive, but it gives you choice, innovation, and world-class treatment. And there's truth to that. America leads the world in medical research, technology, and advanced treatments. If you have the money, or the right insurance, you can access some of the best doctors and hospitals on the planet. But that's the problem. If you have the money, for millions of Americans, even basic care feels out of reach. The system rewards innovation, but punishes those who can't afford it. 7. A global comparison. Let's compare. In Canada, healthcare is funded by taxes. Everyone is covered. No one gets a surprise bill. In Sweden, people pay high taxes, but they get healthcare, childcare, and college included. In France, a doctor's visit costs about $30, and most of that is reimbursed by the state. Meanwhile, in the United States, you might pay $300 just to see a specialist. And if you need surgery or medication, it could cost thousands more. Ironically, Americans spend the most on healthcare, yet often get the least peace of mind. 8. The hidden cost of freedom. So when people say freedom isn't free in America, that's literally true. Freedom means you can choose your doctor, but you also have to pay for it. It means lower taxes, but higher bills. It means independence, but also vulnerability. In countries with universal healthcare, people trade some freedom for security. In the US, people trade security for freedom. It's not about which system is better, it's about what a society values most: personal liberty or collective protection. 9. The future of American healthcare. The good news is that things are changing, slowly. Some states have expanded public coverage, and more companies now offer affordable plans. The government has also started negotiating drug prices for Medicare, a big step toward lowering costs. But as long as the system remains profit-driven, healthcare in America will remain expensive. It's a system built on competition, not cooperation, and in that competition, the patient is often the one who loses. 10. Conclusion. So why is healthcare so expensive in America? Because it's not just a system, it's a reflection of American values. Freedom, choice, and self-reliance come with a price. Other countries chose to make healthcare a right. America chose to make it a business. What do you think? Would you rather pay higher taxes for free healthcare or keep your freedom and pay the bill yourself? Comment below and don't forget to subscribe for more Facts USA and world comparisons.